everybody. My name is Jeremy Goff. Welcome to the Class Insights podcast. Thanks for joining us. I'm looking forward to the discussion today. Today we're joined by Ryan Oliver, who recently authored and published a white paper that we're excited to talk about, titled The Power of Strong Implementations. So today we're going to talk a little bit about this white paper, but more broadly just around the topic of implementations and some of the things we're seeing at Class around implementations. So let's kick it off, Ryan, with maybe just a brief explanation of why you decided to do the report. Sure. Why implementations?
Yeah, good question, Jeremy. So, as you know, this is something that we've known for a long time. You know, at Class, if the audience doesn't know, we're doing about 25,000 interviews a year with healthcare leaders. And so we have just an incredible amount of data, and we're looking at this all the time. And sometimes I think we forget that not everybody has that kind of time or access to all of the data to look at what's really most important. So it's really about time, kind of finally time to take a deep look at this, take the time to analyze our data, and really publish how important the implementations really are. And as you know, in the opening statement of this white paper, we stated that the data, it's actually overwhelming. It suggests that the quality of an implementation, how well it goes, can be even more important than the technology that you implement. You know, it's something that we've seen in our Arch collaborative data and other areas, but it was finally time to take a really deep look at the data from several different angles. And as I mentioned, it is overwhelming how important an implementation is.
Yeah, you know, one of the things that caught my attention early on in your white paper, you talk about how one of the leading indicators of or characteristics of a strong vendor is how well they implement and how well they help their customer with that implementation experience. So even, you know, somebody, I've been at Class for 10 years, you had some data points in there that I had never seen before myself. It's somewhat, I guess, new to even Class. Can you talk a little bit about you know, this correlation between strong vendor performance and their ability to implement?
Yeah, it's the first data point that we looked at is how many of the best in class category winners last year and previous years, how many of them are also the best at implementing their technology? And fortunately, we have that data because in every survey, we're interviewing folks and asking about the quality of implementation. And just to give you an idea of the insights here, we're looking at, from a few different perspectives, but close to 1,500 evaluations across these segments that we looked at more closely. And it'd be a lot more of that than that goes into just one best-in-class report. But essentially, 81% of all best-in-class winners are also the best at implementing in their segment. So vast majority. What was maybe more interesting is when you looked at segments where it's implemented, it's a complex implementation. It's a solution that's used by multiple departments. So a solution like imaging, core EMR, ERP, it is 100%.
Yeah.
So every single one was the best at implementing, and they won best in class, which, as you know, represents their clients are getting what they expect out of it, what they want out of it, are most satisfied with it, with the product.
Yeah. So is it safe to say then one of the highest, if not the highest correlators with having a happy customer base is your ability to give them a very good experience from the start, and really that start is implementation. Is that what I'm hearing?
Yeah, and it's interesting because you can say a happy customer base. And what does that mean? I mean, obviously it means the people that we survey, which over half of the folks we survey are director level or above, mostly executives, are happy with the solution they have. So it's not just the end user. And I bring that up because sometimes you'll hear folks say, well, are we getting the outcomes that the organization wants, whether the end user likes it or not? So it's a very broad perspective. You're absolutely right. Happy customer. A big part of that is determined by the implementation and the best-in-class winner. But also, we looked at this from a lot of different angles, like asking, does the product produce the outcomes you were looking for? And again, no matter how we look at the data, it's very highly correlated to that score of how well the implementation went. I mean, every angle we look at it, does the vendor keep their promises? Does the product produce desired outcomes? What's your overall satisfaction with the product? All of it correlates highly to a strong implementation.
I don't know about, as you were looking at the data and writing the paper, I know when I was reading it, I was reflecting back on all these vendor meetings that I've been in over the years. And, we're lucky enough to have a great group of vendors within the healthcare industry that are doing some pretty amazing things. But as I'm looking back at some of these meetings that I've been in, and it's been a lot of them,
Yep.
and we're asking these vendors, hey, what are you doing to, for your customers, for your prospects? What are you doing to improve, your products, everything else? We often hear, certain things a lot. So one of those things I know we hear a lot is, here's what we're doing in R&D to develop the product. Here's the new bells and whistles we're creating for our customers, right? They talk about some of their sales and marketing activities. Hey, we're going to be at this many events this year. Our booth is going to be this big at HIMSS. They go through this list of essentially investments that they're making to promote their brand, but also deliver a better product or service to the industry. But here's where I look back and I'm like, I don't recall a lot of vendors talking about what they're doing, how they're investing, how they're creating better process around implementation.
Yep.
I'm not saying it doesn't happen, but it's just number 9 on the list of 10 things that we hear about.
Right.
Do you think there's a bit of a misperception around how important the implementation really is?
Yes and no. So I would put it this way. I think when we first published this just very recently, the first few comments that, one of the posts on LinkedIn, the folks that read it said, wow, this is what I've suspected for 20 years, but nice to see someone finally publish it. So I think there are some people that it's kind of an aha where it's a nice validation of what they suspected, but to actually see the real data behind it and say, yeah, this is a big deal is important. But at the same time, I get what you're saying, Jeremy. What are those vendors not saying? Like, you can go to HIMSS and listen to everybody talking about all the bells and whistles, trying to differentiate all the smoke and mirrors and things that are out there. But the question is, okay, what are you doing to have a strong implementation? I mean, we learned this years ago. You remember with the Arch Collaborative, when we started that, there's a health system with EMR-A and EMR-B with the highest satisfaction at the top, and then that same EMR-A, same EMR-B at the very bottom of satisfaction benchmark against the industry. And the difference is how they implemented that and how they support it. Also, there's some other things, but it really does start with a strong implementation. It is the question we should be asking vendors. Like, okay, great, bells and whistles, but half your customers don't implement it well and aren't using just the core functionality and getting the outcomes if you never added a bell and whistle to it that they could be getting.
Yeah, no, good points. Moving on to maybe a different part of the discussion, but still an interesting one. Again, kind of going back to my memory bank of a lot of conversations I've had with both providers and vendors alike, I often hear when referred to the implementation terms like, once we get to the point where we turn the lights on, then we can settle in, we can optimize, then we can really, and it's almost like they've given up on an expectation of having a really good implementation, and they're not going for a great implementation. They're going for turning on the lights. Is that a feasible strategy? I mean, nobody goes into an implementation saying, hey, let's be average, but I think what happens often is they're difficult. And there's some exhaustion that happens, especially during these big implementations, multi-year with a lot of resource.
Yeah.
They're very time consuming. They drain a lot of resource and bandwidth from the organization to the point where sometimes, in my mind, I've never ran a marathon, but I see these marathons where, they're kind of just falling down at the finish line, right?
Yeah.
Is that though, is there better, number one, I guess, 2-part question. Should that be the mindset for both vendors and providers alike? And number two is, are there repercussions for kind of having that strategy of, well, let's just get the lights on and fix it later?
I think there is that mindset, and I do think it's a mistake. I think now, having said that, you should continue to optimize after go live, but you shouldn't count on that making up for a poor implementation. And that's not just my opinion. So here's the data. To start with how big the problem is first, and this may speak to that attitude or that sentiment, that close to half of implementations are rating essentially the equivalent in a grading scale of a C, D, or F. So it's 49% of the implementations. So half of them have a problem, and 36% of them have a big problem. So that's bad. Now, if you start with a problem, so if you start with a poor implementation, and then we look at it and say we survey those executives post-implementation, post-go live, and their score, they're somewhat dissatisfied or very dissatisfied with this product. How many of those are able to do that, to actually go continue to optimize and dig out of that? 25%. 75% stay dissatisfied. So it's not that you can't, but it's very difficult. And I think there's a lot of analogies here, right? Have a bad job interview.
Yeah.
Really bad. And then try to make up for that later. It's just tough. People have their impression of the solution. The general users in an organization are planning on taking this technology after go live and going back to their lives, going back to their jobs, and letting this solution help them. And then to realize, no, more projects, more optimization, more taking time away from an already very hard job. And it's just so much better to do it right out of the gates. And conversely, I'm sure it wouldn't surprise you to find out if they start high with a good implementation, then they tend to stay there for years.
Let me just recap something you said. I want to make sure I'm understanding and our audience is understanding as well. So you're saying about 75% of the time, somebody that has rated a implementation low the first year after they've gone live, when we go back to that same person, second, third, fourth year later, 75% of the time their experience hasn't gotten better.
It didn't improve significantly. So we see some, and I think the data point on that was, did they improve? I'd have to ask our analysts, but it was 8 or 9 points more to really bump them into a more satisfied area. They didn't improve much. So essentially it stayed where they were at.
So what are some of the things that we see as common barriers or pitfalls or difficulties in implementations? And then, to kind of wrap up on a more positive note, what are some of the commonalities we see at class around successful implementations? What are things that are very common that we see, across multiple segments, products, just things that they're doing to drive those better outcomes?
No surprise here, but start early with the planning, set expectations, focus on alignment, and then focus on committing the right resources. And I encourage anybody to look at the report we put in there, some of the themes that we heard over and over, asking healthcare leaders from, providers, asking them, what advice would you give now about your implementation to others that are going to go through this? And the themes that came up most, we highlighted in this report. But starting with that early planning, the vendor needs to set strong expectations, and the vendor needs to hold people to it. It's not, they get a little scared. I think sometimes they'll say, hey, you need to have enough resources to do this right. I mean, you're investing sometimes tens of millions of dollars into a solution, and to skimp a little bit on resources is not wise. But it's not just resources that you add to the implementation or technical resources. Sometimes it's resources that will backfill the responsibilities for internal folks that need to focus on the implementation, so that they have those stakeholders at each department know what's going on, are a big part of it, but also executive leadership. Executives should not leave this to others. to hold everyone accountable internally. So and shouldn't leave it to IT. Another point we put in the report that comes up a lot is a strong focus on change management and governance. And that has to happen within the organization, that focus on change management. And it takes time. It's not easy. But and there's some other things in there. I don't know if you want me to go through.
Well, let me drill into this. I didn't see a lot in the white paper talking about technical issues related to implementations, and we all know they're out there. Integrations can be tricky. Dealing with data and some of those things. There are some complexities to that. But what we're hearing from people when they talk about bad implementations, they're usually not talking about the technical pieces.
Nope.
You mentioned a couple of those. We do hear about, and you have in your white paper, some information about change management. We also hear a lot about governance. What's your thoughts on governance as it relates to how it impacts implementation?
Yeah, I think with governance, making sure that people have clear roles and responsibilities. And it's funny, you and I have joked about this. There's a lot of different, when you ask somebody what's governance, you can get a lot of different definitions on that. So defining who's going to be responsible for what early in the implementation. But I also want to bring up the point you brought up, or revisit the point you brought up, that we don't hear a lot about the technical problems. You're absolutely right. And I know we're going to talk about this a little bit later, but we've been out at these projects, at these implementations. At Class, we've taken this further than just monitoring after the fact. And not one of the implementations where we're out there during the implementation, surveying, monitoring how it's going, providing that benchmark data, not one has the main problem been a technical issue.
Yeah.
It's been, at everyone, we've seen some areas where there's misalignment in the perceptions between the stakeholders, both the vendor, the implementation firm, and at the client organization. And governance has been an issue at every single one, and change management. Those are some of the more difficult areas. It's really changing those processes. I would put a lot on the organization to listen to the vendors early on. So we hear this. This is some sentiment we hear. The vendors say, later when an implementation goes poorly, we'll hear somebody say, well, the vendor should have told me to commit those resources and to commit someone to change management. Then we talk to the vendor, they say, we did. They didn't listen. They're both telling the truth, right? But the vendors that do it well insist. No. They don't just communicate it, they insist, and the provider wants that, right? The healthcare organization wants the vendor looking over their shoulder. They're saying, yeah, but you've done this so much more than me. You should have seen me doing it wrong and really, laid the hammer down and told me, let's do this a different way. We've seen this go poorly with the way you're doing this internally, and they're right.
Yeah, no, that's helpful. I mean, let's talk about, what else is out there for the audience in terms of, Class's focus on implementation. Is this kind of a one and done? Do we expect more from Class around digging deep into the subject of implementation? So, give us an idea of what is on the horizon from Class as it relates to implementation.
You bet. The leadership at Class is investing heavily in helping the industry solve this problem. This white paper represents just the beginning of that, and it doesn't really explain some of the things we've already been doing. But to start with, we have another report. It'll come out very soon, about a month, where we're actually providing benchmarking data so that folks can take, during their implementation, can sort of compare and contrast where they should be at different milestones in implementation, and really have a measuring stick as to, hey, what should we be doing, and how would this implementation, how it's going right now, how would that compare to the rest of the industry? So that'll be hopefully a very helpful report that comes out.
And you'd mentioned, Ryan, sorry to interrupt this. As part of that report, Class interviewed about 120 unique organizations that were implementing different types of products and solutions.
Yep.
So it's not really a focus on one segment, not really a focus on one group of vendors. It's just implementation as a whole in healthcare. What's working, what's not working, and like you said, what are some of the commonalities, both good and bad, that the industry can learn from?
Yeah, and if I were a vendor in healthcare, I would want to look at that report because I would want to lead the market. I would want to do the best job for my customer, and I would put my focus on the implementation.
Yeah.
Now, if I were a healthcare leader at a healthcare delivery organization, I would want to look at that report because I'm trying to invest heavily in technology that will provide more efficiency, better outcomes. If it's a clinical solution, better clinical outcomes. If it's a financial solution, better financial outcomes. And I know that it's not just selecting the right product, it's how well I'm going to implement that. So I would think deeply about it from that perspective also.
Now to kind of wrap up, KLAS, our partners and the industry are so used to us reporting on things retrospectively. And we're going to continue to do that. That's performance-based research, looking back in the rearview mirror, what worked, what didn't, what are people's perceptions with their experience with vendors and products. However, KLAS, we're evolving a little bit in that, starting with the Arch Collaborative, we went a few layers deeper to try to understand what was going on and to try to have more of an impact beyond just the research and the data. And, I'm part of this, so I'll speak to it a little bit as well as we wrap up, but I want your thoughts on what else KLAS is doing to proactively, not just after an implementation goes back to tell everybody, hey, it went bad.
Yep.
You're kind of stating the obvious there. But what is KLAS doing to actually have a positive impact on that implementation as it's in motion?
Yeah, I heard one of our leaders at KLAS, one of our executives, say that when the big first EMR implementations were all happening, and we're still seeing a lot of them with replacements and other things, but when those were first happening, what we're calling landmark insights or implementation transparency, this is what we would have done if we knew this back then. So in other words, now the Arch Collaborative is great because we're looking at if you've already implemented your EMR, you want to see where your satisfaction's at, and you want to see real data that shows you what you should focus on to improve that and make good decisions. So this isn't just deciding on what to buy. This is deciding on what to invest in to get better with what we have. That's the Arch Collaborative. This is what Landmark Insights is doing, is we are there at the implementation during it. We would have done this a long, long time ago had we known the data that I shared in this white paper. But we've been doing it now for some time, as you know, where we're out there at the implementations doing what we do. We're not a consulting firm. We're not doing the technical work, but we are providing benchmarking data. We're monitoring. We call it landmark because we're looking at it and saying, are you hitting the landmark and the milestones that you should along the way? And we're going in and interviewing folks at both the vendor, if there's an implementation firm, a third party, interviewing folks there, and at the health system. And we're looking for that alignment, making sure that the governance is going well, and then we're reporting back. I think the unique position KLAS is in, I hope I'm not stealing your thunder, but is that we don't sell, a couple of these projects that we've been at. One of our recommendations has been, hey, let's add some resources. You should add some resources to this project. It's worth it for it to go well. And we don't sell resources. So, we truly are unbiased. We just want we don't have anything else that we can upsell, right?
Yeah.
We want the implementation to go well.
Yeah.
For the healthcare provider, which ends up, that's good for everybody. That's good for the vendor, the implementation firm that's there helping, if there is one, and certainly for the health system trying to get those.
Yeah, I know we're really excited, and just to add a couple things, maybe in another podcast we'll go deeper into some of the learnings from our engagements with these implementations. But early on, it's interesting to see when you give people an opportunity to provide feedback on themselves, on those that they're working with, in a very healthy way, in a way that it's going to be anonymous, their input, so that nobody feels like they're throwing a project or a particular person under the bus. I think what we're trying to accomplish, and we are, is diagnosing and finding out issues very early. Mm-hmm. While you still have a chance to take corrective action to fix them.
Right.
Because we all know, no big problems, it's most often that big problems start small, right? They're not just a big problem. The trick is, have you set up a mechanism, whether it's class or something else, to catch those small things early on, and then create corrective action plans, to mitigate or to resolve those, so you can keep going forward.
Yep.
And it's been fun to be part of these in at least that role of helping monitor and catch these things early on, and see the progress, the trajectory of the implementation.
And I don't want to belabor your point, but it's so interesting. I think there's a couple of funny things that happen that are pretty typical in implementation. So one is that you want folks internally you want a cheerleader for the new solution, right? Because you want buy-in. You want people to get excited about the new ERP or the new EMR, and you want buy-in, you want everyone to use it, get excited about it. So in the process of being positive about the new solution during the implementation, sometimes a steering committee meeting, one CIO put it, can turn into a kumbaya session, and they're not hearing about the real issues. Second, the can get kicked down the road for way too long. When something that should be on track isn't, how often do we hear, and you've heard this too, hey, at the next milestone, testing is coming up, it'll be done by then. And then it's not. Well, it'll be done. And we have to look at that and say, you do not want a problem, you want to course correct now.
Yeah.
And sometimes it takes another unbiased party saying that.
Yeah.
Sometimes people are talking about but not doing it.
Yeah.
And then coming in and making those changes. We don't pretend to be the be all fix all, but it can make a big difference to just have an unbiased party saying, here's an issue, let's look at it.
Well, Ryan, I really appreciate your thoughts, certainly your thought leadership, and the white paper that you put together is really interesting for me, and it's fun to be part of the work the class is doing around implementation. For those in the audience or listening on the podcast, we will include the link to the white paper, as well as some contact information if you want to get a hold of Ryan or myself, and if for any questions about the white paper, or if you want to learn a little bit more about Landmark Insights, our new implementation transparency service, we're more than happy to talk through that with you. Anyways, thanks everybody. Until the next time.